everyone. I'm Dr. Jismy Mathew, practicing as consultant radiologist at Sri Shankara Cancer Hospital and Research Center. So today, as a part of National Mammography Day and Breast Cancer Awareness Month, I'll be discussing few of the commonly asked questions about screening mammogram. So to start with commonly asked questions, the most commonly asked question we get is who should get a mammogram? So any female who is asymptomatic and is at or above age of 40 should get annual mammogram done according to the international guidelines, which includes ACR body as well. This is applicable on the females who are at average risk for breast cancer. So who all are included in average risk? So female who is not having any positive family history or any genetic mutations which are associated with breast cancer will come under average risk of breast cancer. The high risk females are the ones who have a positive personal or family history of breast cancer and who are tested positive for genetic mutations like BRCA, which are commonly associated with breast and ovarian malignancy, or patients who have prior history of radiation to the chest wall will also be included in the high risk group. Such patients require intensive screening and their screening starts at an early age, which includes breast MRI as a supplemental tool which can be started at the age of 25 years, and annual screening mammogram in such cases can start at the age of 30 years. The second most commonly asked question is why should a mammogram be done? So screening mammogram is proven to detect breast cancer at its early stage when it will not cause any symptom or is not palpable by the patient or by the clinician. So by detecting the breast cancer at its early stage, we can significantly improve the 5-year survival outcome of the patients. And with the increasing incidence of breast cancer in our country, it becomes very important to detect the breast cancer at early stage, and in which screening mammogram will play the most crucial role. The other commonly asked question is what is the role of sonomammogram? So sonomammogram is nothing but ultrasound of the breast. So ultrasound of breast is having its own specific indications, which includes mainly evaluation of dense breast. So mammogram of the breast has its own limitation. With dense breast, it reduces the sensitivity and specificity of the breast cancer detection, in which ultrasound can play an important role. So ultrasound of the breast is very important in dense breast evaluation, which includes the women below the age of 40 years. The other indications of ultrasound breast includes if females have any breast lump during the pregnancy or lactation period. So such females can be evaluated using ultrasound breast, where we avoid doing mammogram. The next most commonly asked question and myth in general population is screening mammogram is a painful procedure. So the most common cause of pain during screening mammogram is incorrect positioning and technique. In our institute, our mammographers are trained and they take precautions so that the patient will experience minimum to zero discomfort by giving patient proper positions and doing it using correct technique. The other common cause of discomfort is if screening mammogram is done just before or during the menstrual cycle. The reason being breasts are usually engorged and are tender during this phase of your menstrual cycle. So we can schedule a screening mammogram just after the menstrual cycle to avoid the discomfort. So what are the things to be kept in mind before getting a mammogram done? So we can schedule a mammogram after the menstrual cycle within 1 or 2 weeks. And the other thing which should be kept in mind is we should not use any talcum powder or deodorant during the screening mammogram, because that can be seen as calcium deposits in your breast and which will lead to false results. So the other most commonly asked question is, what does my report mean? So the breast assessment during a screening mammogram is done using the international guidelines of ACR. So the categories in BI-RADS score are, so BI-RADS 1 means a negative, that is the breast is normal. BI-RADS 2 is benign, that means there is a benign finding which is of not much concern, and the patient can just continue doing their annual mammogram. BI-RADS 3 is probably benign, which means that there are findings in the breast which needs to be followed up. So the first follow-up is at 6 months, followed by 12 months, and after 2 years, the findings, if they are stable, it can be screened using during your annual mammogram. So BI-RADS 4 and 5 are the category where there is finding of concern and which needs further evaluation with detailed diagnostic mammogram, and will also include a needle test which includes biopsy of the breast. So BI-RADS 6 is used for the lumps which are already proven to be cancerous and are usually used in the patients who come after chemo for evaluation. BI-RADS 0 category is used if the scan is inconclusive and we need further evaluation using diagnostic mammogram. So with increasing incidence of breast cancer in our country, it is very important for all women to undergo screening as per guidelines. Thank you.